understand chronic vein disease, you've got to understand the role of veins in the circulation of your body. Veins, as most people know, take blood from your extremities or from the outer parts of your body back to your heart. Unlike arteries, which take blood from your heart away from your heart, there's no pump that gets blood back to your heart through the veins. And that causes problems in your legs because gravity is constantly pulling blood not towards your heart, but blood away from your heart. One of the things that your body does to overcome the effects of gravity on blood is to put the veins within muscles. And as you walk, muscles squeeze the blood, force the blood back to your heart. But they also don't have a directional force to them. They could just as easily be pushing blood towards your big toe as opposed to toward your heart. But fortunately, your veins, unlike the arteries, have valves. They're one-way valves so that when say your calf muscle squeezes the blood or the vein, the blood goes north and tries to go south, but the vein doesn't let it go south or towards your big toe. It forces the blood to go up towards your heart. Then as you relax, the blood stays in its progression back to your heart because the valves don't let it reflux or go backwards back down your vein. What happens with chronic vein disease is due to primarily genetics, but also other things that increase the load on those veins or on the venous return to your heart. That increased load causes pressure on the veins, and then those valves start to fail. And failed valves, of course, now don't allow the veins to do their job. Now, when you walk or you contract that muscle in your calf, instead of having the blood go towards your heart and stay there until the next time your calf contracts, the blood then pools back down into your leg. And that process is repeated over and over with blood sloshing back and forth, going forward and then refluxing, and eventually your vein dilates or gets bigger around. So when we talk about veins failing, two things have happened. The valves have failed and the veins have gotten bigger. And you can see that in a varicose vein, which is a vein that's right under your skin. Patients often ask me what are the signs and symptoms of vein disease and chronic vein insufficiency. And sometimes those are difficult to tease out because veins don't have sharp stabbing pain. I liken it a lot to your stomach. When you're full, it doesn't feel like somebody stabbed you with a knife to say, hey, you're full, quit eating. You feel engorged. It's difficult to describe. The symptoms of chronic vein disease are also similar, especially if you don't have varicose or bulging veins that are purple and sticking out from your skin. That's pretty obvious to see. But oftentimes, chronic vein disease is due to failure of veins that you can't see quite so well or are deeper than the skin. So those signs are not always easy to describe. They're often described as a throbbing or heaviness, tiredness of your legs. Sometimes your legs will actually swell. Oftentimes the symptoms or those throbbing and swelling feelings will get worse after being on your feet for a long time or sitting in the car for a long time. Certainly at the end of the day, symptoms are often worse in patients that have chronic vein disease. Additionally, patients can have other signs that aren't specific to vein disease but are often accompanying vein disease. For example, restless legs and difficulty sleeping at night. While chronic vein disease isn't the only cause, it's often a contributing cause to restless leg syndrome. The treatment revolves around closing down or getting rid of those failed veins. Just like in your house, if you have leaky pipes, you don't keep trying to force water down them. You want to get rid of them and put in new pipes. Well, in your body, we don't have new pipes, But fortunately, we have both that superficial and the deep system. And if the superficial system veins have failed, we want to close down those veins and push that blood flow to the deep system, the good system, the system that is better prepared to take the blood back to the heart. The techniques we use to close down those veins are various. One of the main things that we do, and we want to start at the point of initial failure and work our way backwards. This is usually in the superficial system that kind of looks like an upside down tree, and the trunk of that tree is a vein called the greater saphenous vein, and it joins the deep vein at the groin. We, using a small catheter, we make a small incision and we access the vein, that main greater saphenous vein, down by the knee. We advance a catheter up through that vein, which the patient can't feel, and we put that catheter right before that superficial trunk, or the greater saphenous vein, drains into the deep system. The tip of that catheter has a radiofrequency probe, basically a coil that generates heat, a microwave on a stick. And once we get it up there, we can turn it on and it will denature the proteins on the inner lining of the vein and scar down that vein so the blood cannot flow in it anymore. That forces the blood again to the good deep system, which is our goal. Another thing that we do to get rid of the failed superficial system veins is by using a variety of sclerosant techniques and also phlebectomy, as well as laser ablation, to close down veins of different sizes and shunt the blood or push the blood to the deep system.